What advice would you give to people, Mr. Shepard, who need to talk with friends and family about their diagnosis? You mentioned a certain number of people today got that diagnosis. Okay, you got it. Maybe you were alone with the physician when you got it. Maybe you had someone with you. Now you need to tell people, or do you need to tell people?
I think you do. You need to share it. And I think it begins even before you get the diagnosis of cancer. It's extremely important. I can't emphasize how important it is for every single person in North Carolina to have a medical home, to establish a relationship with a primary care physician or nurse practitioner or physician assistant, but to have a medical home. Know yourself, know your body. Recognize the changes. Pay attention to information the American Cancer Society provides on the warning signs of cancer and respond to that. If you notice any changes, go seek medical consultation and enter into an active partnership with your healthcare provider. That's a long-term relationship. And if everything works the way it's supposed to, that healthcare provider is going to talk to you about diet, nutrition, exercise, smoking, not smoking, drinking behaviors, risky behaviors. They're also going to be the person who's going to talk to you about making sure you are getting screened appropriately. So for your age group or your risk factors, you're getting a mammogram, you're having a conversation about prostate cancer, you're getting a colonoscopy. That is so vitally important. Then, if a diagnosis or suspicion of cancer arises, making sure that you're connected with the appropriate cancer resources. We're very fortunate in North Carolina. We have 3 world-class centers of cancer care at the University of North Carolina at Chapel Hill, at Wake Forest and Duke. The 3 centers are recognized by the National Cancer Institute as comprehensive cancer treatment centers. We also have 27 other, which many people don't understand or realize, that we have 27 other accredited cancer centers throughout North Carolina. So in even small communities of this state, we have cancer specialties in practice providing access to resources and treatment protocols essentially the same that they would get if they went to one of our 3 world-class centers. So it's very important to connect to those. You need your family. So if you have a cancer diagnosis, your family needs to be there. They need to be part of it, because when you are given the diagnosis of you've got cancer, it's almost as if your hearing is cut off. People just go numb. And it's a natural thing. You need someone who's going to be there to hear for you, to take notes, to be your advocate, to ask questions, and to help be part of this partnership team. Jean mentioned, and I hope she'll talk some more, and I'm sure she will, about patient navigation. That is such an important thing that has evolved in cancer care and treatment. When we began talking to cancer survivors about what was important for them during their treatment, those who had a patient navigator said everyone in North Carolina needs a navigator. And so consequently, we put it in the North Carolina Cancer Plan. Every single newly diagnosed cancer patient should have access to a patient navigator.